Depression, top 7 physical effects on health. Depression is technically a mental disorder, but it also affects your physical health and well-being. It leaves a powerful and everlasting impact on the health of a human body and mind. Untreated or unattended depression may lead to various kinds of disabilities both at home and work. Let us study in detail the impact of depression on the overall way of living. 1. Central nervous system. Depression can cause a lot of symptoms within the central nervous system, many of which are easy to dismiss or ignore. Depression is a biological, neurochemical disorder in which the brain does not properly regulate mood, called dysthymia. Remember that the brain is an organ like any other. It's the most complicated and finely tuned organ in your body. If you suffer from depression, the systems that depress your mood are overactive, and the systems that elevate your mood aren't responding properly. To a person with depression, of course, this is an enormous burden and can affect almost every aspect of their life. Depression increases your risk of physical illness. Depression increases your risk of a number of diseases and other conditions by, for example, increasing levels of stress hormones such as cortisol or adrenaline. What is CNS depression? The central nervous system, CNS, consists of the brain and the spinal cord. The brain is command central. It orders your lungs to breathe and your heart to beat. It rules virtually every other part of your body and mind, including how you feel about and interacts with the world around you. The spinal cord handles nerve impulses, allowing your brain to communicate with the rest of your body. Central nervous system, CNS, depression refers to a condition where the neurological function is decreased. So basically, when CNS functions slow down, it's called CNS depression. It can result from substance overdoses, poisoning, or other medical conditions. Slowing down a little isn't necessarily dangerous. In fact, sometimes it's even helpful. But if it slows down too much, it can quickly become a life-threatening event. Having a history of addiction may put you at higher risk of CNS depression. That's because you may be prone to taking more medication than prescribed or combining medication with other drugs or alcohol. You may also be at higher risk if you have existing respiratory problems such as emphysema and sleep apnea. 2. Digestive system. While depression is often thought of as a mental illness, it also plays a heavy role in appetite and nutrition. Depression can lead to a host of tummy troubles. The connection between the brain and the gut is strong, though, making the digestive system one of the most likely places to encounter physical symptoms of depression and other mental issues. However, there are many medical reasons for digestive issues, but not all digestive problems can be associated with depression. Some people cope by overeating or binging. This can lead to weight gain and obesity-related illnesses, such as type 2 diabetes. You may even lose your appetite entirely, or fail to eat the right amount of nutritious food. A sudden loss of interest in eating in older adults can lead to a condition called geriatric anorexia. Eating problems can lead to symptoms that include stomachache, cramps, constipation, malnutrition, gastric distress, loss of appetite. In recent years, however, some digestive issues mentioned below have been identified as possible causes of anxiety and depression. Inflammation of the digestive organs might show up in some people as depression, some researchers suggest. This kind of inflammation is also associated with other kinds of disorders, such as heart disease. Identifying the problem early, perhaps because of symptoms of depression, could be beneficial for sufferers. Leaky gut is a condition in which bacteria that normally stays within the digestive system leaks into the bloodstream. Some scientists suggest that these toxins could worsen depression. Some researchers suggest that the digestion-depression connection could be a vicious circle. Depression contributes to digestive troubles, which contribute to depression, which contributes to digestive troubles. Irritable Bowel Syndrome, IBS, commonly co-occurs with depression or anxiety. Nausea is also a gut problem that usually accompanies anxiety. It can be the result of a chemical imbalance and muscle tension. Both of these situations can be caused by a depression, affecting the brain's communication with the digestive system. Depression and stomach pain are often related, their causes intertwined. Sometimes it can be difficult to tell which came first. For patients suffering from depression and a digestive issue, the most important point is to find a resolution to both. Depression is not necessarily all in your stomach, but resolving the stomach pain can have a positive effect on your mental health, and vice versa. 3. Cardiovascular system. As per recent studies and research, it is known that about 50% of hospitalized heart patients have some depressive symptoms, and up to 20% develop major depression. Mind and mood can affect the cardiovascular system directly by creating a state of emergency readiness, in which stress hormone levels rise, blood vessels constrict, and heartbeat speeds up. If a person is seriously depressed or anxious, the emergency response becomes constant, damaging the blood vessels and making the heart less sensitive to signals telling it to slow down or speed up as the body's demands change. Depression and stress are closely related. Stress hormones speed heart rate and make blood vessels tighten, putting your body in a prolonged state of emergency. Over time, this can lead to heart disease. Depression causes the inappropriate release of adrenaline which, over time, damages the cardiovascular system. An increase in artery and blood vessel stress are further health effects of depression. This can increase the risk of blood clots and heart attack. Untreated depression raises the risk of dying after a heart attack. Heart disease is also a trigger for depression. A study estimates that about 15% of people with heart disease also develop major depression. 4. Immune system. It is by now widely recognized that acute and chronic depression and stress have an impact on the immune system. Acute stress may have a stimulating effect on the immune system, while in the case of chronic stress, and in particular in depression, the immune system may be downregulated. Internal factors such as stress have been implicated in causing a deficient immune system because of the nature of the body's response in dealing with this problem. Depression and stress may have a negative impact on the immune system, making you more vulnerable to infections and diseases. The capabilities of the immune system are diminished after frequent activation of the autonomic nervous system in the case of chronic stresses. The immune system is downgraded to be able to continue functioning. A review looked at studies and found that there seemed to be a relationship between inflammation and depression. Inflammation is linked to many illnesses, such as stress. Some anti-inflammatory agents have shown to benefit some people with depression. Many of the physical changes caused by depression, such as insomnia or a lack of deep sleep, are thought to weaken your immune system. This can make existing illnesses worse. 5. Premature death. Depression, one of the most common types of mental health, is strongly linked to a higher risk of early death. A research reveals that the depression increases the risk of an early death by up to 3 times. Men's risk of a premature passing increases threefold when suffering from the mental health condition, while women's risk is heightened by up to 51%. A depressive episode confers an elevated risk of mortality that eventually decays over time unless there is a recurrent depressive episode, in which case the mortality risk associated with depression remains elevated. The connection between depression and a shorter lifespan appeared strongest in the years following a depressive episode, leading the researchers to conclude that at least part of the risk might be reversed by effectively treating the mental illness. Many cases have been reported where patients suffering from depression attempt suicide or incline towards self-harming methods to get rid of the pain, stress, and anxiety. Reasons may be many, with the bottom line being that depression affects the lifespan of the victim and reduces the age up to 2 times, on an average. Treating depression can reduce depressive symptoms, improve quality of life and potentially prolong life. 6. Loss of memory and concentration. Depression causes many unpleasant effects on health and memory loss is one of the lesser known among them. It has been linked to memory problems, such as forgetfulness or confusion. It can also make it difficult to focus on work or other tasks, make decisions, or think clearly. Stress and anxiety can also lead to poor memory. Depression is associated with short-term memory loss. It doesn't affect other types of memory, such as long-term memory and procedural memory, which controls motor skills. Researchers in a study discovered that people with depression couldn't identify objects on a screen that were identical or similar to an object they had seen previously. This suggests that memory can be diminished as a result of depression. Memory problems relating to depression are thought to happen because your brain's processing speed, its ability to take in information quickly and efficiently, becomes impaired when you're depressed, which affects how you process and retrieve memories. It has been found that some of the parts of the brain associated with memory are physically impaired in depression. It is also known that parts of the brain shrink in those with depression, and this likely leads to cognitive impairment, producing problems with memory recall. People who are depressed are also distracted and have difficulty concentrating, which can prevent them from really focusing on things enough to remember them. Depression has a tendency to trap you in negative thought loops, which is why it's been dubbed an interference phenomenon by some experts. You become fixated on these thoughts to the extent that they interfere with your ability to remember other facts or information. A study on depression and memory found that depression reduces memory capacity by as much as 12%. 7. Memory loss effects. Depression and memory impairment can affect people in many ways. For example, An individual may forget a specific word he or she wants to use, aphasia. Forget the content of a conversation from yesterday. Forget what happened in a book recently read. Have trouble with working memory, when a number of things need to be held in memory at one time. Not be able to remember specifics about their own autobiographical history. Typically, routines are not forgotten nor are skills, but verbal memory may be particularly affected by depression. Memory impairments are seen across age groups but tend to be worse in the elderly. Conclusion: depression contributes to a wide array of physical problems that affect everything from your heart to your immune system. Depression doesn't just cause physical symptoms, it can also increase your risk for, or may worsen, certain physical illnesses or conditions. In turn, some illnesses can also trigger depression. It affects much more than moods. Make sure to treat depression before it is too late, as untreated depression can be a major threat to your life.